Hi there. Thank you so much for checking us out here on our YouTube channel today for your medication needs and other medication related questions that you have. And as a way to support our community here at DamiRx Care, we do recommend you subscribing to our YouTube channel. Also, we would like to gift you for subscribing to our YouTube channel. And if you check the description bar below, you'll find a link where you can download a free diet meal that we do have here as you commence on your healthy lifestyle and habit. All right, there. Let's talk about the medication of choice today. So the medication of choice today is Itraconazole. So Itraconazole is known as a medication that's used for treating fungal infection. So patients that have HIV infection as well as a fungal infection, in addition to that, benefit from this medication as it can help clear up that fungal infection and kind of reduce how well they're feeling, what in addition to their HIV infection. And also this medication can be used for patients who have a fungal infection of their nails. This medication can also be used for vaginal fungal infection or a condition called pulmonary aspergillosis. So these are all categorized under fungal infections, and like I said, this medication can be used for a wide range of fungal infection. So how is this medication taken? So the medication is usually taken as a 100 milligram or 200 milligram tablet, and it's most likely taken from days up to weeks of starting this medication. So like I said, this medication comes in a capsule and it also comes in a solution as well. So depending on what the doctor is trying to treat, they may put you on the capsule or they may put you on the solution. So like I said, depending on what the treatment is, you could be taking the 100 milligram dose or the 200 milligram dose, but it's usually taking, one tablet, and you just take that for days to weeks, depending on the treatment that the doctor is aiming for. So what are some side effects of Itraconazole? So some side effects of this medication include high blood pressure. So this medication can increase your blood pressure. Also, some side effects include rash as well as itching. It can cause swelling, headaches, dizziness. It can also cause diarrhea, abdominal pain. It can cause nausea as well as fatigue or fever. Some patients have noticed UTI while taking this medication, which is urinary tract infection, as well as sleepiness. So just make sure that you're looking out for these side effects. It doesn't necessarily happen in everybody, but just in case if it does, these are side effects to look out for while you're on the medication. So what are some serious side effects that you definitely want to be reaching out to your doctor for immediately when you start noticing them? So if you start feeling any chest pain, trouble breathing, or some palpitation, if you start noticing like that you're coughing up blood, or any cold sweats or a bluish colored skin, you definitely want to call your doctor's attention to that. Also, if you start noticing a dark urine or pale stools, or you start noticing nausea, vomiting at an abnormal form, maybe it's very consistent all throughout the day, or loss of appetite as well as stomach pain or a yellow skin or eyes, you definitely want to reach out to your doctor regarding this. This might mean that you're having some liver issues going on. So you definitely want to reach out to your doctor about that. As I said earlier, if you feel any palpitations, any fast or pounding heartbeat, you definitely want to reach out to your doctor regarding that as well. Or if you feel like you're losing your hearing sense as well, like if you're having a hearing loss, you definitely want to reach out to your doctor while you're on this medication. Also, if you start feeling any numbness, tingling, or burning sensation in any parts of your body while you're on this medication, this is definitely the time to call your doctor and let them know what's going on. Also, if you start noticing any rapid weight gain or swelling in your face, ankle, or your feet, then you definitely want to reach out to your doctor regarding that as well. So not too fast. So let's talk about other things to look out for while you're taking this medication. So you definitely want to take this medication with a full meal to ensure that this medication is well absorbed in your body. Also, in patients that are taking contraception, you want to make sure that you're avoiding pregnancy while you're on this medication and up to 2 months after your last dose. So if you took your last dose, let's say the end of December, you definitely want to make sure that you're using contraceptive up until the end of February. So with this medication, like I said, you want to make sure that you're swallowing the whole capsule or the tablet. Also, you want to make sure that you're taking this tablet or the capsule at the same time each day. So it's recommended to take it all at the same time each day. And also, you want to make sure that you're taking all the medication as prescribed to you. You don't want to stop after a couple of days of taking this medication just because you feel fine. The infection might not be cleared all the way, so you want to make sure that you finish the total dose as prescribed by your doctor. Also, it may take several weeks for the infection to go away, so that's another reason why you want to make sure that you're completing the therapy as prescribed by your doctor. Also, this medication may make you feel dizzy or drowsy, so you want to make sure that you're not operating anything that has to do with you being mentally completely aware. Maybe if you have to drive or operate any machinery, make sure that you understand how well your body tolerates this medication before participating in any of this activity that requires you to be mentally alert. All right, so also while you're taking this medication, you want to make sure that you're keeping all your appointment with your doctor. That way they can access, and do some lab work on all the organs of your body to make sure everything is okay while you're taking this medication. Also, like I said earlier, you want to make sure that you're taking this medication as prescribed by your doctor. If you have any questions or concerns, make sure you're reaching out to your local healthcare provider. That way they can point you in the right direction. All right, I hope you were able to learn 1 or 2 things regarding how to take this medication safely and effectively while you're treating that fungal infection that you may have today. Don't forget to like and subscribe our channel in order to support us here at DamiRx Care, and please stay tuned.